So I'm really pleased to introduce Dr. Florencia Polite. God, Polite, we're going to go for the Polite. So happy to have just met you. You can read her bio, but what struck me about who we affectionately call Rennie, we love giving really important people really cute nicknames. I think that's a kind of a good thing. But it struck me how funny it is that we can take what we think is a really small step about something we think is really important, only to find that we make a giant difference. So, Rennie.
Thank you. Well, those of you who don't know well that I took a long time today to pick out my outfit, only to have to take off my jacket in the first 2 seconds of Nikki talking, okay? Because I was like, wow, we're getting hot and heavy quite quickly. So it's really an honor to spend some time with you guys today. My talk is June 2020, Finding the Strength to Move Forward. The beginning of June 2020 was a pretty stressful time. I was personally outraged by the events of the preceding week, from the white privilege exhibited by the Central Park event involving Christian Cooper to the horrific death of George Floyd at the hands of those who have the responsibility to protect us. The racism in our nation was brought to the surface, and we were compelled to confront this country's views of Black people. After the murder of George Floyd, I was in a number of meetings and realized that I felt like I was going to cry. And I said to one of my colleagues, and he said, "You should just cry." And I said, "I did that already, and I don't actually feel much better." As the most senior African-American member of the Department of OBGYN at the time at Penn Medicine, I decided to write an email to our division about what it felt like to be a Black person coming to the hospital every day after the death of George Floyd, and how, as a leader specifically, we had to pull ourselves together every morning to walk back into these spaces and function as if the events of the outside world were not affecting us. That immense stress and pressure was almost insurmountable to me. One of my colleagues was in the midst of organizing a protest, and she asked me if I would lead it. And I said, absolutely. We thought it was going to be fairly small, and it ended up being thousands of students, staff, faculty, doctors, cafeteria workers, and custodians at Penn Medicine. The event was held at Penn's Franklin Field, and it was massive. I thought long and hard about what I was going to say to this crowd. I wanted them to understand the pain and the agony that many of us were feeling, the frustration, the anger, the resentment, and the helplessness. But most of all, I wanted action. I wanted us to find the strength to move forward. And as I looked out at the faces of the audience, I saw that people were very focused on what I was saying. Some were crying, but I could see that what I was saying was resonating. And I talked about how we at Penn Medicine are in a very privileged position, that our responsibility as caretakers and physicians goes beyond just the practice of clinical medicine. We needed to acknowledge that systemic racism in our country, that this was an event that was not just about ending police brutality. This was a movement about ending the structural racism that allows police brutality to exist. I believe that the obligation of healthcare systems extends beyond clinical care and biomedical research. We have a responsibility to the patients we care for to understand the social determinants that affect their healthcare. We have a duty to acknowledge that systemic racism that permeates our country also affects the lives of our Black and brown patients. And we must work to dismantle every aspect of structural racism, from the redlining of housing districts to voting discrimination, mass incarceration, lack of educational resources, healthcare inequalities, and police brutality. I challenged us at Penn Medicine to start having some uncomfortable conversations around privilege, race, and discrimination. If you have not already, I challenge you to start having some of these conversations in your healthcare systems as well. When we knelt for the 8 minutes and 47 seconds at Franklin Field, I acknowledged that it was going to be painful, but that we had been comfortable for too long. I asked that during that time that people reflected on 2 to 3 actionable items that they would do in their own lives to address structural racism. One of the first people to come up to me after the event was a custodian on labor and delivery. I'd speak to her often, I'd ask about her family, and she literally came up and gave me this huge hug and said that she was proud of me. It is hard to be a member of many communities, to be a member of the Black community, to be a member of the Philadelphia community, to be a member of the Penn Medicine leadership team. As healthcare workers, we're helping people every day, patients who may not have the educational wherewithal to engage in their care. But I felt very much in that moment that what needed to be said was that medical care is not the only way that we can make a contribution to our patients, or to Penn Medicine, or to Philadelphia. So where are we on this journey that we started on in 2020? Overall, I'm proud of where we are as an institution. We've appointed vice chairs of DEI in multiple departments with protected time to do the necessary work. We've created ACT, Action for Cultural Transformation, an organization who develops strategies to ensure equity, mitigate bias, and eliminate racism at Penn Medicine. I'm most proud, though, of the commitment of the C-suite, whose financial incentives are tied to a decrease in health disparities in both obstetrics and cancer. Penn wants to be a leader in research and clinical medicine, and now strives to be a leader in the fight to end systemic racism. But this journey is not an easy one. The fight to end systemic racism is not a straight line to justice. There are days when we feel like we have made substantial progress. And then there are days when I have to remind myself that it took us 400 years to get here, and this will take a long time to make substantial change. That paralyzing feeling of anger and resentment has recurred since 2020. In fact, sometimes often, as yet another Black body lay thrown aside, becoming the latest hashtag. My hope is that I continue to find the resilience to wake up every morning ready to continue this fight. We have to get there to a place that's better for my children and a place that's a better environment for our patients. Thank you.